Hi, I'm Dr. Craig Escude, President of IntellectAbility. Welcome to Medical Monday. So today we're talking about one of the fatal 5+ conditions in people with intellectual and developmental disabilities. And we're talking about today what I jokingly consider the number one cause of just about everything in people with disabilities, and that is constipation. It's not a topic that we all really enjoy talking about, but it's necessary. It's very important. Um, you know, who is at risk for constipation? Which people are more at risk for constipation or bowel obstruction? Well, people who have had some sort of previous abdominal surgery can be at a greater risk for a bowel obstruction type picture. People who are on multiple medications. There are many medications that slow the movement of things through the intestine. And when things move slower through the intestine, more water gets absorbed, which makes the stool a lot harder, which in turn makes it harder to pass. And so many people with disabilities are on things like psychotropic medications, some of the antihistamines and cold medications. Iron can also be a constipating type medication as well. So any medication with what we call anticholinergic effects can increase the chance of having constipation. People who don't move around very much have an increased risk of being constipated. And we know that many people with disabilities have limitations in their ability to move on their own. Think about it. Have you ever had surgery or known someone who had surgery? And one of the first things they tell you to do is to get up and walk around because that gets your bowels moving. It gets things moving. Well, if you can't do that, it makes it a little bit harder to have a bowel movement. So people who also have diets that aren't necessarily the best. So maybe they're not getting enough fiber. Maybe they're not getting enough fluid. And then one other thing to consider in people with disabilities in particular is that something called pica behavior. Pica behavior is when we eat things of non-nutritional value. So some people with disabilities may pick up things off the floor, whatever they find, and eat. Or they may, I've had patients who would pull the cottony fibers out of their diaper and then try to ingest them. So you can imagine if you eat those types of things that it can cause a blockage. So those are people who are a little bit more at risk. How might it present? Well, people who are able to express themselves verbally might tell you, gosh, my stomach hurts. Oh, I haven't been able to go to the bathroom. But what happens more often in people with disabilities who might have difficulty using words to verbalize exactly what they're trying to tell you is they may communicate through behaviors. So what you might see is someone becoming agitated, someone becoming aggressive because they're hurting and they don't know how to express that. You might see someone also becoming less alert or less active, meaning what we call a decreased level of consciousness. They may want to sleep. They may want to curl up in a ball. All of these types of things could be an early sign that they're having trouble with their bowels. In my practice, when people would present to me with a problem of, or the staff would come and say, "Hey, this person just isn't acting right," one of the first things we always ruled out was constipation because it is so unbelievably common and so easily fixable. You can, add medications, but you can do things immediately to relieve that impaction. And I mentioned number one, and some of you, especially if you're a nurse or work in this field, you'll understand what I mean when I say remember constipation being number one, because one of the things that we have to do sometimes to identify it and sometimes even to relieve it is do what we call a digital rectal exam, where we use our finger to check and see if there's firm or hard stool in the rectum, and then we can do things to help relieve that. So that's a little bit about constipation, why it's important to think about, why it's important to remember, to know what to do. You can learn more information about this in the Clinical Pearl, or there are also lots of other ways to learn information about this. You can also reach out to us at IntellectAbility at our website at replacingrisk.com if you have any questions or want any more additional information.